With the outbreak of the COVID-19 pandemic around the world, psychological feeling becomes an expected matter. Therefore, doctors warn of the repercussions of the pandemic on the psychological health level.
Doctors also called for the need to consider psychological health by adopting behaviors and skills that enable them to cope with this virus. More on the following report.
With the spread of the virus, the psychological health of many collapsed, and the number of patients who suffer as a result of the psychological pressures caused by the virus increased.
As we continue to see rising in the psychological effect of this pandemic up till this moment, and these psychological impacts is not affecting they are not affecting only people who have been infected by the virus, not even the family members or even those who have lost somebody, a close member of a family, and so on. No, the psychological impact is affecting the whole community, infected or not infected, being actually affected by this pandemic or not. So there has been so many effects going on, especially on sleep pattern. There is so much of symptoms related to sleep pattern. A lot of people are complaining of insomnia, irritable sleep, nightmares, even if they did not have any psychological issues before the pandemic.
While panic spread from shocking scenes in the corridors of hospitals, sadness from difficult times in light of the outbreak of this virus, specialists sent advice to relieve these pressures.
We would say, before you go to sleeping tablets, please try sports. Before you decide to find any kind of remedies to help you to sleep, try to reduce the amount of caffeine you are consuming per day. So small things are far much important than going to trying sleeping tablets or going to antidepressants or these things. Definitely, some people would need an extra help, but just small measures are far much important than going to try to find some kind of medication to help you to sleep or to improve your anxiety, to reduce your anxiety or to alleviate your depression.
Psychiatrists assure that everyone must adapt psychologically and have the ability to deal with reality and crisis, stressing that there is no need for concern but caution, which becomes a duty at this stage.